Health and social care. Case study George. Tips. Number 1. Dementia-friendly services. Care and support for George to help him live well with dementia as well as MS and the impact on his family. To always treat and understand the individual with dementia as a person and not treat them different, always respect them. To always focus on what they can do and enjoy, as this will help them fit in, as this is what is important to the individual and their families. To keep up to date with regular health checks, as this is an important part of their well-being. Improve training and knowledge on dementia. Physios can assess problems that restricts a person's physical activities, as well as how able they are to join in with everyday life. The physiotherapist can work with George to encourage and promote his physical activity and maintain his mobility and independence for as long as possible. This will have a positive impact on George's family, as they felt as if they were no longer meeting his needs. 2. Advocacy. An independent advocate is a person that would be specially trained to help provide and find information for George to get the care and support that he needs, to be able to stay at home and keep him safe with his wife and son. With this support, George, and with the help of the advocate, and knowing what is important to him and that he has choices, to help him to communicate by making sure that he has voice and control and that his rights are maintained, could allow him to the benefits of continuing to live the rest of his life as normal as possible and give him the things to look forward to. For example, attend his photography group in the community, visiting his friends. All this benefits George, as this is what his life used to be before the early onset of dementia. This will all contribute and benefit George's well-being. 3. There are 5 professional codes of practice for the Mental Capacity Act. They are: Principle 1, a presumption of capacity. This is reflected in the case study George. He had the rights to make his own decisions. He was asked what support he would like to enable him to live well with his dementia and manage his physical well-being. Principle 2. Individuals being supported to make their own decisions. This is reflected in the case study George. He was given support to make his own decisions, as he asks if he can attend his photography group and perhaps meet up with his friends again. It was agreed that a trained team in dementia care will support him to achieve his goals. Principle 3. Unwise decisions. People have the right to make decisions that others might regard as unwise or eccentric. Everyone has their own beliefs and values, which may not be the same as those of other people. Principle 4. Best interest. This is reflected in the case study. George agrees with his family that he would benefit from external support. Penfro Care work with George and his family to agree a care package that identifies George's individual care and support needs, with his best interest at the forefront of his decision. Principle 5. Less restrictive option. Someone asking a decision or acting on behalf of a person who lacks capacity must consider whether it is possible to decide or act in a way that would interfere less with the person's rights and freedoms of action. Any intervention should be weighed up. 4. There are 5 principles of social well-being. 1. Co-production. To help George be more involved in the design and provision of his support. To work with him and his family so that his care and support is the best it can be. By involving George and his family more will help recognise the strengths and expertise they can bring to, as this will change their relationship with the services, so they will no longer simply be using the services but helping to design and provide them. Well-being. To involve George in the discussions that impact his life, keeping in touch with his friends and attending his activities in the community to achieve his goals as this matters to him, so he can enjoy well-being in every area of his life, but to also support Gwyneth and Evan with the support to help care for George. Prevention and early intervention. To help George ask for help when he needs it, and to help ensure his situation does not escalate and that he is safe. Gwyneth and Evan can access support to assist them in their caring role and maintain their own well-being. Voice and control. To support George with what is important to him, enabling him to live well and achieve what matters most, keeping him at the centre of the decision making and making the most of his independence, giving him stronger voice and more control. Multi-agency. Involving health organisations to help support George with his MS and early onset dementia, such as the physiotherapist, community services, so that they can help support him with the activities that he used to enjoy to improve his quality of life and well-being. 5. Mental capacity, well-being and best interest decisions. An assessment was made with George and his family. George had choices of what support he would like, putting him at the centre of his care to manage his well-being and best interest. George's dementia has affected his behaviour and how he interacts with others, as he can sometimes misunderstand things. George has outbursts of anger, which has resulted in him being physically challenging towards Gwyneth. He has lost interest in his photography and friends and is less active. 6. Assistive technology that could benefit George that are in the case study. The use of a computer, as George used to be active on social media with his friends and other racing car fans. An activity was planned and George was enthusiastic and displayed no signs of challenging behaviour when completing his tasks. George then, over the next few days, enjoys talking to Louise and his family about all his positive comments he received after posting their work on social media. George then decides to email his friends who live nearby to arrange a get-together. His behaviour begins to change and he regains his interest in what he used to do. 7. Potential impacts, mental well-being, living with dementia, decline, factors. That George encounters increased agitation and outbursts of anger resulted in being physically challenging. Increased withdrawal from activities and friends which could lead to depression or anxiety. George could end up suffering with unhappiness and detach himself from everything that was important to him due to his dementia. 8. Potential impact physical well-being living with dementia decline. Factors. George lost interest in his photography and didn't meet with his friends anymore. He was less active. His behaviour and mood of how he interacted with others became affected. It resulted in outbursts of anger and being physically challenging. 8A. What is being done to prevent this, or what can be done to prevent this? To engage with George and his family to find out what is important to him, to gain his trust and build a strong relationship with him, to be able to deliver person-centred care. To get George to participate in activities that will stimulate and interest him to promote his emotional well-being. 9. Multi-agency working. What other professionals are identified in the George's case? Healthcare and social services with their assessments. Specialist nurses, example physiotherapists, that are able to deal with dementia and help support the family. Community day centres for activities. Penfro Care and doctor surgeries to check on the progression of his dementia and how to keep it under control. 10. Sources of support identified in the case study. Healthcare and social services with their assessments for George's well-being, such as co-production that let George be more involved with the design and delivery of the service provided. Care worker Louise specially allocated specifically to support George, which enables her to build up a good working relationship. Specialist nurses, physiotherapists, occupational therapy that visit George once a week. Multi-agency to ensure that George has all the correct equipment, example, ceiling hoist, shower chair and wheelchair, etc., to support the needs of his MS. Extra questions not asked in the tips. Support that would be available for dementia. Healthcare and social services for their assessments. Specialist nurses that are able to deal with dementia and help support the family. Doctor surgery to check on the progression of his dementia and how to keep it under control. Methods used by Penfro to meet George's needs are to give support and care to George and the family, and to agree a care package that identified his individual care and support needs. They allocated Louise a specific individual to support, which enables them to build up a good working relationship. George had choices of what support he would like, putting him at the centre of his care to manage his well-being. Reasons why Louise takes time to find out about George's interests and his background is to gain his trust and to build a strong relationship with him, to be able to deliver person-centred care, to find out what is important to him, to get George to engage in activities that will stimulate and interest him and promote his emotional well-being.